Our guest here is Jim Coyle and Joshua
Withrow.
Withrow, Withrow. Joshua Withrow from the Freedom Works. And where are you now, Josh?
I'm sitting here in our headquarters here in Washington, D.C. on Capitol Hill.
In Washington, D.C. on Capitol Hill. Well, you know, I got a letter from Freedom Works a week or two ago saying that they were going to have to put more money into Obamacare because it was not working, at least financially. And, you know, I'm a medical doctor, and I see that myself all the time. There was a time when you had a co-payment of $10 or something, and the insurance company would pay the rest. Now you have to pay $30, and the insurance company may or may not cover the rest. And it's, you know, and they don't want to pay for medicines. A lot of medicines that they always used to pay for, even generics, they're saying, oh no, we can't pay for that anymore. It just seems like there's a lot of financial stress going on. Could you enlighten us a little bit about all that?
Absolutely. So in reference to the bailouts in particular, I mean, this was one of those things that a lot of folks were warning was going to be an inevitable result of the law from before it ever passed. Because, you know, what it's trying to do is this granting essentially universal insurance coverage, but then not allowing the market to actually determine what the rates are that they can charge for that coverage, and then also forcing the insurance companies and doctors to cover a defined list of procedures and practices. And so, as you know, the inevitable result of something like that is going to be, so on the insurance end is going to be the insurance companies are going to, they're going to pass the costs of all this extra stuff and all these people that they're going to be forced to cover onto the consumer. And, of course, what was supposed to happen was this individual mandate was supposed to force everybody, including younger, healthier people who may not have insurance because they didn't feel they needed it. It was supposed to force them onto the market to counteract all of the healthier, the less healthy, sicker people who were getting this subsidized care. But of course, we've seen that's not happening. And as a result, for the past 2 years, 3 years running, and again, we're looking to see it again in 2016, the insurance companies keep on having to jack their rates up higher and higher and higher. Yeah. And even then, they're still really not making the money they'd like to make. So I think that as a result, the next thing you can expect to hear them demand is that in exchange for having to cover all these people, they're going to want more money from the taxpayer. And you're starting to already see whispers of that happening here.
Well, now, Jim is a young, healthy fella.
Fairly healthy, not so young anymore.
What do you have to say about all of this?
Well, you know, it's unfortunately, it's exactly like a lot of people predicted. I know a fellow Freedom Works fellow member with you, Tom Borelli. You know, Tom and I have been speaking together at events for 3 or 4 years now. You know, at different grassroots events, and you know, and we've talked about this for, you know, since the inception of Obamacare, that eventually that there was going to be another kickback to the insurance companies, that people weren't going to come running to it, that it wasn't what we really wanted. But the second half of that conversation always would turn out to be, this is simply a vessel to move us to a different system, a single-payer system, which you're starting to hear everybody talk about now. Oh, well, if there's so many problems with Obamacare, we just need to move it to a single-payer system that would make it easier. You're hearing a louder and louder cry of the Democrats going to preach this method now. So, you know, it was a vessel that was very encumbersome, very intricately woven into everything we're doing to make it difficult to take apart. And once you get that fundamental structure in place that's integrated into everything, that makes it so difficult to move it away, but it makes it easier to move it towards single payer.
Well, Josh, do you think this thing was meant to fail from the beginning so that they could, like Jim say, go into single payer, or in other words, totally socialized medicine?
I don't know about the motivations of some of the people who actually wrote the bill, the people who themselves, but certainly a lot of the people who supported it, including a lot of the Democratic leadership and President Obama themselves. I mean, they've acknowledged that they understood that this was at best just a bridge toward what they wanted, which is, like you're saying, socialized medicine. And I think that, there have been various Democrats who have finally, although usually not very publicly, admitted this to be the case. The most public of whom was Harry Reid, the former Senate Majority Leader, now the Minority Leader, who literally said in public, we understand that Obamacare is just, it wasn't particularly well designed, but that's okay because it's the first step towards getting socialized medicine.
Well, what do you think will happen? Will the American people go along with that, or will it take more legislation? And hopefully now that the Republicans have more votes in the House and the Senate, that they could block such a thing.
Yeah, I mean, we're in a whole different world than we were in 2009, 2010. I don't think that we're yet at the stage where either the American people or Congress are going to be willing to accept that. And if you remember, initially, Congress in 2009, 2010, they wanted to go further. They wanted to introduce this public option, an actual publicly controlled, essentially, insurance company that was going to compete with the private market. And, of course, you know what the result's going to be of that. It's going to undercut private competition, force private insurers out of the market, and boom, you have your single-payer system, right? Well, they weren't able to get that because even with a supermajority of Democrats, they weren't able to get enough Democrats to vote for that a few years ago. So with the Republican-controlled Congress, I don't think we're in imminent danger of getting there. But, of course, the danger is if we can't get this Republican-controlled Congress and then hopefully we get a decent guy in the White House to act soon, in the very short term, before this becomes even more of a crisis, the longer you let the Obamacare kind of sit and fester and dig its roots into the healthcare system and destroy it, the harder it's going to be to actually try a more patient-centered, market-oriented alternative, because it's literally destroying the market that used to exist.
Yeah, absolutely. And is it not right now, as it stands, putting the Supreme Court rulings aside for a minute, the actions that have been taken since this has been written into law have been unconstitutional? We should have the employee mandate already. The dates for the open enrollment should not have changed. There's a list of things that happened after this was signed into law that were arbitrarily changed by the executive branch alone without legislation. Is that not unconstitutional, and is that grounds to start a repeal movement?
I think you're totally right. I mean, out of the, I know Grace Marie Turner of the Galen Institute does a fantastic job of tracking all of the changes that have been made to Obamacare since it was passed. I think there's 47 now, and out of them, I believe over 20 of those were made by the executive branch with no authorization from Congress, and several of them are just blatantly against what they actually have the power to do in the law.
Yeah.
And so I do think there's a case to be made against those. And of course, the only problem is now we have a Supreme Court that's demonstrated that they don't actually seem to care how the law's written or what the Constitution actually says. And so our recourse, to me, my personal opinion is that I don't think our recourse to address this law is going to be through the courts. We're going to have to rely on the American people to force Congress, the people's body, as it were, to dismantle this thing.
Good point.
Well, now some people said that, when the Supreme Court ruled that it was a tax, that put a problem with it, that it should have originated in the House like all taxes are supposed to, and because it didn't, that maybe there would be something that handle that you could attack it that way.
I definitely think the case that you're referring to, I can't remember what the name of the case is, but yeah, it's attacking the origination clause. The problem that I see with that case, and I certainly hope that it goes forward and that perhaps the Supreme Court will do the right thing, but the problem is that this practice of taking a House-passed bill that's relating to taxes and then gutting it and replacing it with a brand new Senate bill, and then sending it back to the House is actually a fairly common procedure. It's not like it hasn't been done before. It might not have been done before to the extent that they did it with as major a piece of legislation, but it's been a precedent that's been allowed for quite a number of years now. So I'm not sure if the Supreme Court's going to be willing to what they consider to be a matter of kind of procedure in Congress, because technically speaking, if you want to get super parliamentary about it, technically speaking, the bill for Obamacare did originate in the House. It's just that the Senate gutted it and used it as a hollow vessel for Obamacare.
I don't know if you're familiar with this. This is a DVD that was produced by Colin Gunn, and the name of it is Wait Till It's Free. And it goes into socialized medicine in the United States and in Britain. And, you know, he says, well, he's from Scotland, I think. And he says, well, you know, the English people are told they have the best medical system in the world. And he talks with people and says, well, it's probably the worst medical system in the world because they have a program which is sort of like death councils in Obamacare, where they take people that are costing them a lot of money and put them in a ward where they are basically allowed to die. And he had a doctor that came on and he spilled the beans on him about this, I forget now what they call it, but it was basically a council where they said, well, this guy's too old anyway, we're just going to put him over here and let him die in this ward. And that this has been a practice in English socialized medicine in England. And they said, well, they exposed it and they kind of cut back on it, but he says he thinks it's still going on. So, you know, Josh, this thing, we got 100 copies of this. This is a really good video. And if any of our listeners would like a copy of this video, we'll send them to them for free, because we think that there's a lot of problems with Obamacare, and this exposes a lot of them. And if you call us right now, 893-2444, we'll get this out to you right away. And if no one is there to answer the phone, just leave a message on the answering machine with your name, address, and phone number, and we'll get it right out. 893-2444. Yeah, well, it just seems like there's a lot of problems that it's not working financially. Was that right? The insurance companies are taking a hit because, like you say, a lot of the young people didn't buy into this scheme because they don't need it, they don't want it, and so the whole thing is going up in smoke.
Yeah, absolutely. And if you just look at the pure math of it, the thing that's saddest to me is that even the people who actually thought that Obamacare was going to really help them and that this was going to be this great deal for them, yeah. A lot of them, not all of them, but a lot of them who are getting these plans through the exchanges in Obamacare are suddenly finding out, great, they have insurance and they can't afford to use it. Right. Because these lower level plans, the ones that are more affordable within Obamacare, a lot of them have deductibles that are in the multiple thousands of dollars range. They have huge copays. Yep. And so if you're a family who didn't have insurance because you couldn't afford it, now you have insurance that you can apparently afford but now can't use, and so they're in just as bad a spot as they were before. And of course, a large percentage of the people in Obamacare who were uninsured, who have now been put into insurance, haven't been sent into Medicaid. Which, of course, is a program that provides subpar health care and very, very bad access to routine primary care as well, and which, of course, 40% of doctors won't even take patients who are on Medicaid either. So Obamacare is presenting people with a lot of people with bad options, false options, and in the meantime is driving up health insurance costs for everybody across the board. Well, so it's hard to see it's kind of hard to see a silver lining to this cloud.
Because, you know, at the end of the day, it all comes back to finances. And when this program was getting started, it was, you know, $800 billion, and then it creeped up to $900 billion. At the end of the day, it was $1 trillion. And then we launched a website that crashed and burned miserably and failed and had all kinds of glitches. And we spent another $500 billion fixing and repairing a website and putting in new security procedures that double time. What we should have done the first time, we came back and did the second time. So, we're $1.5 trillion just trying to get this thing launched. This bailout to the insurance companies is another $1 trillion. $2.5 trillion. We still don't have the full law implemented. We still don't have it integrated everywhere. So, we are just blowing money and getting nothing in return except worse services and worse conditions for our medical services. In 2009, our 3rd District Congressman, John Yarmouth, had a town hall meeting. And, it was a pretty mixed group of Democrats and Republicans and independents in the meeting. And so I went to finances when I had an opportunity to ask a question. Very plain and simple. Medicare, Medicaid, Social Security, they're government-run programs that take our money and take care of it for us, and how well are they doing? They're broke. They're going broke. They've been mismanaged. If this is another $1 trillion, one simple question: how are we going to pay for it? And I'll give the congressman, who I don't agree with about just about anything, credit for this one moment, because he was completely honest with the people and said, I don't know. And they signed it anyway. He signed it anyway, not having any idea how he was going to pay a $1 trillion bill. He signed our life away financially. And that is the root of the problem with Congressman Yarmouth and others across the country that signed their name on the dotted line having no idea what they were getting into. And until we get people focused in, and finances seem to be a great way to do it, get them focused in on these people don't care about your finances and will spend your trillions of dollars until we stop them, maybe that'll get people serious to do something about their representatives.
Yeah, I totally agree. It's one of the things that we've been trying to hammer away at ever since the law was passed, but it made our argument easier for us when they launched the website and people started seeing it firsthand, and you started getting people with cancellation notices on their insurance and these high insurance premiums and everything. It's just to be like, guys, this isn't even a partisan issue. I know it looks like one. I know it's only the Republicans who seem to be against this law and the Democrats who seem to be for it. But if you just look at the real facts and you do the math and you see how this is affecting millions of Americans, this law is not working. And it's not just not working; it's unworkable. It's not fixable. The entire system that underlies it is completely broke.
Yeah.
Now, who is it? Gruber? Is that the guy's name that said that they were trying to be dishonest or not transparent right from the beginning, and they knew all of these problems were in there, but they said, "Oh well, we'll push it through anyway."
The stupidity of the American voter.
The stupidity of the American voter.
Yeah, exactly. The fact that he was willing to actually admit this on camera is just kind of mind blowing, but it's the exact attitude. It's, well, people don't understand how to take care of themselves, and so we, the paternalistic government, will come in and do it for you. And that's the theory that underlies all of Obamacare, and it's one of the reasons why it's so irreparable.
Now, Josh, everybody knows there are a few problems with our medical system here in America, but most people think that what it needs is health savings accounts and allow insurance companies to sell insurance across state lines so that there's more competition, and maybe tort reform. And but he didn't do any of those things. And none of the things that were needed did he do. He put in all of this where he's like a king on top of a mountain, and he tells everybody what to do, what they can have, what they can't have, and whether they're going to live or die. And Gruber said it right. It was a deception right from the beginning.
Yeah, I think one of the key points here is like you're saying. There's all these alternatives that have been put out there, but there's not a single one of them. At health savings accounts, competition across state lines, tort reform, block granting Medicaid to the states, and there's all sorts of policies, right? And there isn't a single any one of these that's a silver bullet for making the healthcare system work either. And I think sometimes Republicans and conservatives actually fall into that same trap of thinking that silver bullet exists. instead of just acknowledging that the only way that you ever get a healthcare system that actually does the absolute best it can for the most people, including especially the people who have the least, is to really open it up to market forces and to actually allow actual competition to happen and actually allow doctors and patients to find ways to make it work. Because, for example, health savings accounts are a great example, but they may not work very well if you don't have enough of an income to sustain a health savings account. You may need some sort of other option. There are all sorts of charity care options that are out there that right now aren't very workable because of government regulations. And then innovation in the healthcare system, both with medical devices and in just the practice of medicine in general, are all being suppressed by the FDA and other federal regulations. But there's this whole market, there's this whole opportunity out there to continue the revolution of what was one of the better healthcare systems in the country, and instead we're going the opposite way. And like you said, trying to impose this top-down monolithic solution. And both sides of the aisle are guilty of this. We need to start looking towards actual freedom as our solution.
Hey,
Right.
Josh, I noticed you got a Rand Paul book behind you. We are in Louisville, Kentucky.
So I do.
What's that?
I said, so I do. Yeah, that's my bookshelf. So
Yeah. What do you think Dr. Rand Paul would bring to this argument as far as fixing the problem we're in with Obamacare?
I mean, I think his arguments actually sound an awful lot like mine. That book that's sitting there behind me, the reason why it's there is because it's the most recent one that I just read. So he actually lays out this plan for himself. So I won't speak for him. I won't claim to do that. But basically, what he's been saying is the same sort of thing. It's not just the need to repeal Obamacare. It's the need to more fully get rid of both state and federal regulations right now that are stopping healthcare from actually functioning, and that are taking all the autonomy away from doctors and patients. And it's an insanely complex, wide variety of government restrictions right now that we need to start figuring out how to ratchet back.
Well, basically, it seems to me that if someone goes to a doctor, they want the doctor to have their interest at heart. Okay, not Obama's interest at heart, but their interest at heart. Okay, and there was a time when you went to the doctor, you paid the doctor answered to you and took care of you, and that has gone out the window. Now we have all the doctors working for Obama and trying to do what Obama wants, because Obama's the boss, and the patient gets lost in the shuffle. And it's just a terrible system. It didn't work in England. It's not worked anywhere. And they're still, it's the same old story. They want to control everything.
Yeah, I had a really interesting conversation one time with Dr. Paul Brown, a former member of Congress and a medical doctor himself. And one of the interesting things he brought up to me was kind of talking about his own practice, and also other doctors he knew who were a little older, kind of old timers who were talking about the way that it used to be and how they used to actually try to take care of the people in their communities.
Amen.
How they used to have more charitable care, and a lot of the charitable care stuff that they used to do is now actually difficult to do. If a person's eligible for Medicaid, it could actually get you in trouble. You're also talking about the way that the doctors, always used to set aside certain amounts of time to do certain kinds of procedures for either for barter or for discounts for certain populations.
Right.
So the point that he was making to me is that before the government kind of came in and took over the vast majority of our medical system, our communities and our doctors and our medical profession used to find ways to make sure that people were not that were getting the care they needed. And ironically, by providing everything for, as you said, free, now it's actually harder for a lot of people to really get care.
Right. Let me mention this again. This is a video on socialized medicine, and it's brand new. It just came out, and it's something we would like every one of our viewers to have. And if you'll call us now, we'll send it to you for free. The number to call is 893-2444, and we'll get that out to you right away. And it's It really is a good explanation of socialized medicine in general. In Canada, people come from Canada into the United States and pay for their surgery themselves a lot of times because they can't get the CAT scan or the MRI up there, and they got the animals are getting the CAT scans instead of the people, and it's just a terrible mess. Everything is political, and if you have the right inside with the politicians, they'll try to help you, but otherwise you're in trouble because they don't have the money to do everything they promised to do.
I agree. I mean, things are really not looking up right now for the healthcare system. I would want to, if you don't mind, I'd like to plug one thing we're trying to do on a more optimistic note, to actually sound one note of hope and how we can actually change this. We actually haven't launched this nationally to our list yet. This isn't fully launched, so you'll be getting a little bit of a scoop. But I've been working with a Dr. C.L. Gray, who's a medical doctor out in North Carolina, and he has a group called Physicians for Reform. And he and I at Freedom Works and his group Physicians for Reform are launching this collaborative work where we're trying to do more to find doctors like yourself who are concerned about the direction of healthcare in this country, and to inject more of the physician's voice into what needs to be done to actually cure what's done to our healthcare system. And so, if you want to check out what we're doing, he has this set of principles and not super detailed, because we didn't need to come up with a super detailed plan. There's plenty of those out there, but just a set of principles that underlie what a free market healthcare system ought to look like for when Republicans hopefully get around to actually trying to work on this in Congress. And the website where you can find all of that is freemyhealthcare.org. So that's freemyhealthcare.org, and you can see what we're working on. I'm really excited. We just now launched this, and we're hoping that it catches on and injects a lot more of your kind of voice, the physicians, into this fight, because you guys are the ones who know what's really going on and can really see how this is affecting patients at the ground level, and going to be a huge part of the solution.
And Josh Withrows, if people want to get in touch with you at FreedomWorks, how can they do that?
They can always email me. My email is jwithrow@freedomworks.org, and you can check out all of the information that we have on our website at freedomworks.org.
Awesome.
The other thing that bothers me is Obamacare is forcing everybody, or almost everybody, to pay for abortions.
Exactly. I mean, the First Amendment gives you a right to free association and freedom of contract, and that should also mean not associating with and not using your taxpayer dollars to pay for things you don't agree with. That's a basic principle.
Joshua Withrow from Freedom Works and Jim Coyle.
And if I may, I've got a little bit of announcement myself.
Okay.
Resistance Radio has been moved up 2 hours. I'm now on at 8 p.m. on Sunday nights. So 9:70 a.m. The Answer, 8 p.m. Sunday nights. Join me for Resistance Radio.
Tune in again next week for the rest of the news.